There we go. Costal is a 4-year-old child who was left in the garbage can for him to die. His parents left him there after they found out he was infected with HIV. Costal is one of the 30,000 Romanian teens and children infected by the HIV virus. Some children have gotten the virus when their mother, while pregnant, received a blood transfusion from someone who was infected. Others got it when a needle that was used on an HIV patient was used on them as well. This topic is important to me for 3 reasons. First of all, I am a sophomore nursing student at a Christian university where we are taught how to use nursing as a vocation to be the hands and feet of Christ. Second of all, as a Christian, we are told 2,000 times in the Bible to help the orphans and the widows. And third of all, as someone who feels that this is God's calling and vocation for me. Dictionary.com defines compassion as deep sympathy and sorrow accompanied by deep desire to alleviate suffering. Missionary nursing is used as a platform to promote compassion, which is something that God values through tending to people's physical, psychosocial, and emotional needs. Physical needs are tended to through education, medicine, and surgery. Psychosocial issues are tended to through deciphering signs of issues, educating patients on the causes of issues, and helping them to overcome those issues. And spiritual needs are tended to by teaching the patients about God, teaching them that God loves them, and spreading the gospel. Missionary nurses promote compassion through tending to people's physical needs. First of all, they educate. In many countries, people are unaware of the causes of illness and how illness is transmitted. For example, nurses may teach to wash your hands after going to the bathroom and to not share needles. Second of all, nurses treat patients with medicines that are not otherwise available, or there may not be someone to administer those medicines. And lastly, nurses provide surgeries in clinics. World Vision is a humanitarian organization that works in poor countries, providing the less fortunate with clinics and medicine that the government cannot otherwise provide. Missionary nurses may work in these types of clinics and administer this type of medicine. Nurses also tend to needs through psychosocial needs. Ackley and Ladwood's nursing textbook, Nursing Diagnosis Handbook, teaches nurses how to tend to psychosocial needs of patients. First of all, they decipher the signs of psychosocial issues. Next, they educate patients on the causes of those issues. For example, hopelessness may be caused by abandonment and deteriorating physical condition. And lastly, nurses help the patients work through and overcome those issues. For example, if the patient is experiencing hopelessness, they may define goals, identify areas of control, and spend time with the patient, all of which have been shown to decrease signs of hopelessness. And lastly, missionaries nurses tend to spiritual needs. They teach the patients about God. They teach them that God loves them. Oftentimes, these children don't know that God loves them because they've never heard it before. They become depressed, don't realize that they matter, and stop taking their medicines. However, when they are taught that God loves them, they are given a sense of value and purpose. And lastly, missionary nurses spread the gospel to these patients. Joshua's Project is an orphanage that missionary nurses work at. So far, they've been teaching the kids the gospel, and only 5 have died without receiving Christ. Missionary nurses promote compassion by giving medicine to the sick and the gospel to the unreached. They work through meeting people's psychosocial, physical, and emotional and spiritual needs. They work to change the fact that in this world, 42.9% of the people are unreached. 30 million are not immunized against treatable and preventable diseases, and the 3 biggest killers are treatable and curable. They also try and change the fact that 14 million children are orphaned by HIV and AIDS. I would like to close with a quote by John Stuart Mill. He says, A person may cause evil to others not only by his actions, but also by his inactions, and in either case, he is justly accountable to them for the injury. This meaning that just because we are not the reason that these people do not have certain things that they should, that does not mean that we cannot be held responsible if we do nothing to help them. Missionary nurses promote compassion by meeting people's physical, psychosocial, and spiritual needs. Thank you.